Okay, start with the patient laying in supine with their legs hanging off the table. And then you're going to have the patient bring their legs up and then slowly drop one. And if their hip touches the table, then that means they do not have tightness. And then come back up. And try the other leg, and if the hip does not touch the table, then that means that they have tightness.
For this test, you will have your patient seated and ask them to internally rotate their hip and then externally rotate their hip. Then you will place your hand above the knee to stabilize it and place your hand on the lateral part of the leg to check for internal rotation. Then you'll switch and go to the medial part of the lower leg and check for external rotation. And if they have limited range of motion, then that could mean possible injury or deformity to the hip. For this test, you will have your patient first roll on their unaffected side. Then you will place one hand on the hip and one hand on the knee and ask your patient to raise their leg to a 20-degree angle and apply downward force as they do this. Then you'll have them roll to their affected side, place one hand on the hip, one hand above the knee, and ask them to raise it 20 degrees. And if they show weakness, then that is a sign of, that is a lack of abduction strength in the hip.
First, you want your patient to lay on the unaffected side. Then you put their legs in the forward figure form position. And then as you lift their leg up, you want to add resistance. And then you want them to flip to the affected side. And put them in the same position. And then as you lift their leg up, if it shows weakness, then they have lack of abduction. For this test, we're going to ask the patient to stand straight in front of us with a hand on each hip. You're going to ask them to lift one leg, making sure that their hips stay even. You're going to hold this for 30 seconds and then switch legs. If you feel a drop in the hip and the patient is unable to hold themselves up, then you may have a hip abduction injury.
First, you will have your patient lie down in supine position. Then you will have them bend their knees at about 90 degrees. As you take their leg, you'll put your forearm under their knee to stabilize it and apply downward pressure as you ask them to apply upward pressure to check for strength.
Okay, have the patient start with laying down on their stomach with their feet hanging off. Apply one hand to their thigh and one hand to the back of their ankle. Have them push up as you are pushing down, and then go to the involved side and do the same thing and look for differences in weaknesses. You're going to start with the patient laying on their side, one hand on the hip, one hand on the calf, and you're going to flex backwards and let it drop. And then you're going to roll over to the other side. One hand on the hip, one hand on the calf, flex backwards, let it drop. If the patient cannot drop their leg to the table, then they might have tightness in their IT band.
You'll have your patient laying flat on their back with their legs out straight. For this one, you will have your hand on the lateral side of their ankle and medial side of their knee. You'll ask them to rotate inward to check for the elasticity of their LCL. For this test, you will have your patient laying flat on their back with their legs out straight. You will start with the affected side and place your hand on the medial side of their ankle and the lateral side of their knee. Then you will ask them to apply external force while you apply opposite force. This is to check for the elasticity of the MCL.
Okay, for this you're going to have the patient lying in supine position, and you're going to lay on top of their, or sit on top of their leg. And you're going to apply resistance towards you and then away from you. And look for deformalities in the patella.
Oh, sorry, I didn't see you there. First, you'll have your patient laying flat on their back with their legs straight and relaxed. Then you will put your hand under their foot and your other hand on the lateral side of their knee. You will have them bring it into full flexion and rotate it. Then you will have them bring it back into flexion and rotate it the other way. This is to check for meniscus damage.